Welcome everyone. I am Andrew Duckworth and I would like to thank you for joining us for our special series of BJJ podcasts on the COVID-19 pandemic. The pandemic is the most significant healthcare crisis of our generation and has led to severe worldwide disruption like which we have not seen in many decades. Through these podcasts, we hope to consider the main issues that have arisen as a consequence of the COVID-19 pandemic for us in orthopedic and trauma surgery, as well as on our healthcare profession as a whole. We hope to give you insights from our colleagues throughout the UK, as well as from across the globe. We'll also take the opportunity to hopefully look forward to the future in terms of both the recovery phase and what we can anticipate when the worst of this pandemic is hopefully over. So today I have the privilege of being joined by the President of the BOA, Mr Donald McBride, who I know will be able to give us an exceptional overview and insight into the clinical and professional challenges we are facing each day at both the national and regional level, how this is affecting training and education, how the BOA is working very hard to help with these issues, and finally what is in store for us moving forward. Many thanks, Don, for taking the time to join us today.
Not at all, Andrew. Very, very nice to speak to you.
So, if we could just first of all talk about, obviously, we'll get onto the bits of our specialty that's affected. But if you could give us an overview of what you feel the impact of the pandemic has been on the NHS as a whole, both on our healthcare system, our ability to provide service, and the potential consequences we are seeing and potentially will see moving forward.
Well, I think that this is something that probably not many people envisaged was going to happen, even when matters started in Wuhan just a few months ago. In the UK, it is almost like a wartime deployment. We have effectively wartime politicians at the present time. And I think that because of that, the NHS and the economy is going to be very severely affected for some months to come, basically. The problem we have in kind of like generally is not just in orthopedics, but staff are being redeployed across the whole scale of things. We are seeing retraining of surgeons to do things that they probably never expected to ever have to consider. And that's also the case, I think, with our specialist nurses.
Yeah.
I think a number of specialist nurses are also retraining to do things that they probably weren't expecting to do as well. I think we should remember that it depends a little bit of where you are in the curve as well of the pandemic. Having spoken to a number of people across Europe and across the world in the past week or so, we are all at various different parts of that curve. Yeah. And in fact, politically, we're all using very different methods of managing the problem. Some, for example, in Sweden are kind of like effectively doing very little, expecting things to come quickly and pass quickly, which they probably will. And others, of course, are suppressing things by self-isolation and a number of other techniques, more or less to protect certain parts of the public.
Yeah.
They say the over 70s, but it might even be the over 50s from what's been going on recently. And of course, those who have previous health conditions are more likely to be more severely affected. I think in the longer term, we have to bear in mind, and it's not often an orthopedic surgeon will talk about this, but the mental health issues of people, including the staff, is going to be quite significant, I think. Yeah. It's very difficult, and we've seen videos online quite regularly recently of nurses from intensive care and other parts who are clearly very drained by the whole process. So I think that now, currently, in the future, there are going to be quite a number of mental health issues we'll have to deal with, even including in our own staff, effectively.
No, absolutely.
It is quite a difficult time for everyone.
No, I agree, Don. I think what's been interesting about doing this series is how that theme of mental health, both for the healthcare profession and our patients, has been a thing that's come up every time. And I think it's something we have to be very wary of, because it's something we can, in times like this when we're just concentrating on our clinical care, we can sometimes forget about those things, can't we? And I think it's something we must keep very much in the forefront of our mind.
I think about we forget about them principally personally.
Yes.
The other thing that is important is actually our own hygiene.
Yeah.
Going to and from work, it should now be quite a religious kind of process, effectively. I.e., we should be making sure that we protect our family, friends, and those around us as well.
Yeah.
That's particularly the case coming back from work, but actually going to work is also quite important, how we deal with things. We should not be seeing staff in uniforms in supermarkets, etc., that sort of thing. Yeah. I get a bit concerned when occasionally I do see people like that.
No, absolutely.
That's something we have to bear in mind.
Absolutely. So if we move on from that, Don, and talk about very much our specialty, the trauma and orthopedic specialty, what do you feel have been the main sort of impacts that you've seen on our specialty so far?
Well, this has been quite interesting, actually. From the trauma point of view, things have decreased quite significantly across the board. Major trauma, other aspects of trauma care seems to have dropped quite a lot. I think that we have to also bear in mind that quite a number of other specialties seem to be having the same issue. We've been told that things like acute abdomens, problems like that seem to also have dropped. No one seems to understand quite why, appendicitis, etc. So it's not just in trauma and orthopedics that there is an issue regarding that side of things, but it certainly across the board has been affected. Clearly, there are other things that have happened. So elective care has been suspended. That will have quite significant short and long-term effects. We went into this on the back of quite significant inpatient waiting lists. And our Prime Minister actually said that was going to be one of his major things he was going to try and address. And of course, this will really have affected that quite significantly.
Absolutely.
The elective side is going to be interesting, shall we say, over the next few months as well. Training is obviously important, and education. Now, if you speak to, again, people across Europe, as we have done, I think they're looking at things in a different way. A number have actually said that this is educational. It's something we should be learning from. And of course, when you look back at wartime, etc., that is when trauma and orthopedics actually learned a lot. It may be the wrong sort of type of thing to learn from, but in fact, that's what you do. Yeah. So across Europe, they're actually turning this to training and education experience as much as possible, given the concerns, obviously, regarding the virus itself from that point of view. I think that the other side of things that's important, of course, is that we don't have as many face-to-face calls as many face-to-face interviews anymore. We don't see patients very often. You can, but you really should keep that to the bare minimum.
Yeah.
We were talking about virtual fracture clinics, and now we're talking more or less about virtual everything, effectively.
Yeah.
And it has to be said that technology out there is really quite significant now for doing this. So video conferences with your patients are quite important. These will probably be mainly in those who have had trauma care effectively.
Yeah.
Elective patients that you might want to catch up with just in case there's an issue,
Yeah.
or they might catch up on you from that side of things. The patients are really important, however. We need to try and remember that they are going through a delayed treatment for a lot of things, such as total joint replacement.
Yeah.
So we need to contact and involve ourselves with patients and patient groups and actually try and get a handle on how much that has affected them, because I think that will be quite significant.
Yeah, no, absolutely. Do you think, I mean, pick up on that, do you think, obviously we have changed the way we're seeing the patients at the moment, like you say, with technology and things like that. Do you think any of that, when this is finished, do you think that could persist in some ways? There's been some benefits, like you say, learning from our experiences and taking it forward and advancing things potentially in some ways?
There are some very good articles on this, and I think that it's undoubtedly that we will be doing more.
Yeah.
I think we were kind of going down that line anyway. It's just that this has become more evident, and probably for a lot of conditions, particularly for follow-up appointments, a video conference with your patient is just as effective.
Absolutely.
Surgeons in general terms like to examine their patients, not necessarily once, but more than once. So it will probably be a little bit of an issue. But I think that that's going to be becoming much more frequent.
Absolutely.
I'd say, as you say, that would be positive.
Yeah, no, absolutely. I agree. I think it's interesting to say about the training. I think, again, having spoken to some people from Europe and elsewhere, we spoke to Kenny Gall in America as well, coming up. And I think it's interesting how they have said the same thing. It's almost, rather than thinking of this as trauma and orthopedic training, this is training to be a doctor. And actually there's a lot to be gained from that. And I think that is definitely true. And that's definitely your feeling you've got as well from that.
Indeed. And of course, actually, in lots of ways, it's gone back to the original surgical training, because people do not go through emergency departments anymore, but they certainly are probably doing that now.
Absolutely, yeah.
And that basic training which I had, and which a number of my contemporaries will also have had, included this kind of care.
Absolutely, yeah.
And therefore, perhaps a revisit is not such a bad thing.
Absolutely. No, I agree. So if we go on to sort of the role of the BOA, what has been, you feel, the main, I suppose, issues that you as a BOA have taken to tackle during this crisis, both on a national and regional level?
Well, I think what I have to do here is say that the offices of the BOA have been closed, but the BOA staff have been absolutely wonderful in the support that they have given to this, and particularly in policy and programs, but also in other areas. We have been signposting and delivering on our website updates for our members, for our patients, and for those who wish to access them from here and abroad. In fact, in my conversations with those from abroad, a number of them have been using these time-posted documents. We have a boast, which we've been using in the past. We have specific BOA member information on the website. We also now have a transient journal of trauma and orthopedics with the coronavirus, which has been very well looked at. Plenty of hits on the website for that one. It has very good articles looking at various issues, including legal issues about what may be the situation in the future. Of course, we have links to NHS England, Public Health England. That's about the sort of thing we were talking about: PPE, personal equipment, laminar flow. There's a little bit of contention about that. I think our guidance is much clearer than some.
I agree.
Again, has been used very well from that point of view. So these are the main things that we have done, and I think that we will continue to do that. We update it quite regularly, sometimes at the beginning every couple of days, but now it's probably down to a few days, perhaps a week, as we are kind of like heading into the more difficult part of what's happening in the UK. London has been badly affected initially. In America, that's been shown in New York. So when you have the big conurbations, that is where they will be affected. And it's going to spread out to the provincial areas now. Okay.
Yeah, absolutely. No, I totally agree. And in terms of, I suppose that leads on nicely, how I mean, nobody can predict the future, and I think this is probably one of the hardest things to predict moving forward. And as we've mentioned before, maybe a sense of positivity if we can find one. But how do you see us progressing, I suppose, over the next weeks to months in our specialty? And how do you eventually see us sort of coming out of this, not only as a healthcare system and as a country, but also as our specialty as well?
Well, it's always a little bit difficult to be positive at this situation, having spoken to colleagues from Spain and Italy in particular, who've been having a terrible time with this condition.
Absolutely.
I have to say that there is some uncertainty. So I think the immediate future, really, we're going to be staying in lockdown for longer than people think. I think that's going to go on for a little bit longer than people think. I've heard various timescales on this, 6 months, 12 months, some people even this morning on BBC News, 2 years. So I think that return to what we might call normality might be quite a bit in the future yet. I think from an orthopedic point of view, we're hoping that the suspension of meetings, for example, courses, education, and so on, hopefully will start to kick in towards the beginning of 2021. But I can't see it being before then.
Yeah.
And one of the biggest conferences, EFORT, has just cancelled relatively late on. But I think there are other reasons why that's happened. So effectively, I think it's going to be longer than people think. I think we'll never go back to normality, as you call it. We mentioned earlier on about things like video conferencing, that sort of thing. We have to be a little bit wary about some of the conditions and so on that we treat. Perhaps politicians will revisit some of the things that we treat. I think that it's important that we make sure that our patients remain central to all of this, because it is their orthopedic and trauma conditions that we are really sort of focused on trying to manage now, in the future. And there will be, I hate to use the term, but there will be a tsunami of orthopedic problems when this all comes to an end.
Yeah, no, absolutely. That's interesting, and I think that's right. I think it's as you say. I think what I think as a profession and the public find out, it's the unpredictable nature of it, isn't it? But I think the feeling is that we have started on this path, and if we release things too early with regards to the lockdown, we could end up with just being where we were, having had this time off already. Would you agree with that? I think that's
But what we have at the present time is, I think the politicians are actually being relatively sensible in the UK. It's always terrible to say absolutely sensible, but relatively sensible. Yeah. And I think that the only potential risk they have, and they've already highlighted it themselves, is that they may have a second bounce.
Yeah.
Okay?
Yeah.
So they have actually created a situation where they've quietened it down regarding the surge, which might affect intensive care, etc., in hospitals. But by doing that, you don't have the herd immunity that people talk about, which means that second surge is less likely to occur.
Yeah.
So your protected groups, if you have a second surge, may be even more at risk.
Yeah. Yeah.
But I think at the present, we will just have to see how far the lockdown goes, and hopefully people will manage it themselves, because I think that people do need to realise that it is what they do that's important.
Absolutely.
I heard a thing yesterday about allowing younger people to go out, and because they're much less at risk, and I was thinking, unfortunately, they're the ones who are going to spread it to the ones who are at risk. So that's probably not the best idea.
No, absolutely. Well, Don, thank you for that. And that's all we've got time for. But that was a really excellent overview and insight today, and we really do appreciate you taking time to join us. I know how busy you are at the moment. I really do appreciate it. Thank you.
Thank you very much, Andrew. Thank you.
And finally, as always, we'd also like to acknowledge and thank our many colleagues around the UK and across the world for their ongoing enormous efforts and contributions in the delivery of care to our patients during this difficult time and during this pandemic. We at the Journal thank you, and we'll continue to support you in any way we can. Stay safe and well, and thanks for listening.